We all aspire to live a long and healthy life, and we've worked hard to get to where we are. We should be able to enjoy the benefits of this with our loved ones for many years to come, whilst in good health both mentally and physically. I'm Dr. Simrat Marwah, General Practitioner and Medical Director of OneWelbeck's Health Assessment and Longevity Centre. There are many, often small and incremental ways we can achieve and extend a healthy lifespan by years, if not decades. These are often poorly understood, lack personalisation, or are implemented too late. That has, in essence, been the main driver for me in wanting to set up and develop this service. My role and vision as Medical Director is to ensure that we have the optimal programme available that is tailored to our individual's needs. I have worked as a doctor in both the NHS and private sector for several years and ended up setting base here in central London. I now provide care to a select group of patients who have access to the best global healthcare. Building on what I have learnt and from being involved in their health journeys, both here in the UK and internationally, I wanted to develop a programme and develop a centre that is not only the leader in the UK market, but also worldwide. What we want from our healthcare is unanimous. People want access to their healthcare provider, access to the top specialists who use the latest technological advances and are up to date and at the forefront of medical practice. We all have an aligned goal. We want to implement health actions and plans that allow us to pick up problems early, implement change, and take the right steps in ensuring that one does not fall victim to disease that could have been prevented. Setting this up at Welbeck was the clear choice. We have 350 doctors practicing in this building, including clinical leads and professors from each of the major teaching hospitals across London. We have unrivaled access to both the latest screening approaches and the top expert opinions if further care is required. By investing in the best technological advances, being actively involved in research, and continuing to learn and develop, the ethos that resonates here is that highest quality patient care is paramount, and prevention is better than cure every single time. We benefit from all of the testing modalities we could want under one roof, some that are only available at Welbeck. At OneWelbeck's Health Assessment and Longevity Centre, we focus on three main areas: ensuring that we catch any problems early, ideally before you notice any symptoms, reduces the potential impact on your current and future health. By identifying the areas where we can reduce the development of future disease, and by managing risk factors, if already present, we aim to reduce illness and promote longevity. Although we can't change our genetic makeup, we can undertake genetic screening. We offer whole genome genetic testing as part of our screening service and have chosen who we partner with very carefully to deliver this. Genetic counselling requires expertise and experience, and that is exactly what we have in our specialist team. Tackling issues that are impacting your day-to-day quality of life right now will positively impact your healthy lifespan in the future. Our world-leading respiratory consultants, who specialise in sleep, stress the importance of awareness education of sleep disorders. Sleep quality is affected by a number of factors that, if identified and managed successfully, can be life-changing. Sleep disorders are drivers of a large array of health complications, including heart disease and stroke. You meet with your screening clinician ahead of your testing day. The initial stage of the process is designed to help us understand your health concerns and risks and discuss your health goals. We implement your individual screening programs with your dedicated screening clinician. It is our goal to make this an easy, stress-free and smooth experience. You are appointed a dedicated patient liaison manager who will be with you throughout your testing day. You will be taken to your private executive pod where you will be able to safely leave your belongings, take meetings and rest in between tests. Food and drink options will be provided, taking into account dietary preferences. We have access to over 300 testing modalities within our centre, and we have carefully selected those that will be of most benefit to you. Brain health is an important part of our screening. Globally, headaches affect 40% of the population, and MRI can help us to rule out sinister underlying causes such as tumours. We can also detect diseases that cause cognitive decline. If detected, abnormal findings can be identified early and acted upon by referral to specialist care for early assessment and management. We also assess body composition analysis using MRI technology. This gives us an overview of the composition, including visceral fat and muscle quality. Visceral fat is a risk factor for disease, including heart, liver disease, and diabetes. Early intervention to reduce this reduces risk of developing these diseases. We are one of a handful of centres in this country that uses this radiation-free, highly accurate technology to assess body composition. We use the most advanced mole mapping machinery in the country to capture a 360 map of your entire skin in a few seconds. Along with dermatology consultation, this allows us to identify sinister lesions, flag up any changes to moles when repeated at your review, and identifies new moles that have appeared since previous mapping. Incidence and mortality from melanoma, the most serious type of skin cancer, continues to rise worldwide. Early detection of melanoma is therefore crucial, as surgical removal of early-stage disease usually results in cure. We are the only facility in the UK that has access to this AI-driven mole mapping technology. Our digestive health centre specialists screen for and manage an array of diseases, including bowel cancer, liver disease, and gut health imbalances. If not identified early and addressed, these have a very detrimental effect on longevity. Colonoscopy is the gold standard screening method to diagnose bowel cancer, which is in the top 3 causes of cancer death in the UK. Not only can we diagnose bowel cancer, but more importantly, we can identify pre-cancerous lesions that can then be removed, thus reducing the risk of bowel cancer in the future. OneWelbeck boasts the largest private endoscopy unit in the UK, with over 34,000 procedures performed since opening 5 years ago by 30 of the UK and internationally recognised endoscopists.
Unfortunately, the incidence of liver disease is on the rise. Since the progression of liver disease is often asymptomatic, it's important for us all to be screened for liver disease before irreversible complications arise. As part of your health screening process here at OneWelbeck, you will be screened for underlying liver disease. This will include using a variety of techniques, including blood tests, imaging, and a FibroScan. The FibroScan particularly is a very important test we use. It's a non-invasive test to screen or evaluate the amount of fat in your liver and for the presence of any scarring, which allows us to tell whether you have any evidence of chronic liver disease.
Breast screening via 3D mammogram can help us to detect cancers early, when they are still so small that we are unable to see or feel them. Annual screening has been shown to decrease the risk of death related to breast cancer by more than 25%, again highlighting the impact of proactive healthcare. This mammogram technology is the only one of its kind in the country. The technology we use at Welbeck uses the power of AI to enhance the level of interpretation and analysis of the images produced via mammogram, allowing us to have the most technologically advanced screening unit in the whole of the UK.
We also offer one-stop clinics, triple assessment clinics at our centre, which enables the consultant surgeons to be able to assess the patients if you are worried about anything, any symptoms, anything that's concerning you. And then our radiologists can also use this technology to offer 3D mammography and again breast ultrasounds if that is needed to diagnose. If at that same visit we do need to do a needle test, biopsy, tissue sample, then again we can do that at the same visit.
Prostate health is always topical. I see men of all ages and a very high proportion, irrespective of being in their 30s or 70s, will ask me about prostate cancer and screening for it. Our screening assessment includes a clinical history, examination, PSA blood test, and an initial MRI scan that allows us to assess the prostate volume. If risk is identified, we refer to one of our specialist colleagues for further assessment, and this often includes the dedicated MRI scan of the prostate. Our Men's Health Centre is driven by a team of innovative and research-driven specialists. We have AI-driven technology that we use to aid in the diagnosis of prostate cancer. If found, we have access to cutting-edge technology in the form of focal therapy that allows us to treat the disease with minimum side effects of treatment. We use cardiopulmonary exercise testing, CPET, to assess heart and blood vessel function, fitness, lung performance, and breathing patterns. All of this is done in a single test which takes about 20 minutes. We receive a lot of information from this test, but perhaps the most well-known is the peak oxygen consumption, which is a global measure of fitness and heart and lung health. As a single measure, it is associated with longevity, and most importantly, can be improved with exercise training and lifestyle intervention if warranted. We assess heart disease using ECG, echocardiogram, and run bloods including lipid levels and apolipoproteins. We can assess the health of the major vessels that supply the heart with blood with a CT scan known as a CTCA. This gives us a very good idea as to what one's risk of developing complications of heart disease are, and we can intervene early. Heart disease remains one of the top causes of death. The CTCA scan we use here at Welbeck has one of the lowest doses of radiation, while still producing the most high-quality images, and our world-renowned cardiology department are on hand to interpret results and advise on future management. I had asked one of my cardiology colleagues to give me a one-liner as to why we screen for heart disease. His response? The first presentation is too often the last. Heart disease kills. Early prevention is key. Screening is paramount. We take your tests and consolidate these to give us a picture of your current health. You will receive a report that you can share with other members of your medical team if you wish to do so. This report will give you an outline of all of your test results, what these mean, and what recommendations have been made. Your screening clinician will discuss the results and the actions needed to be taken, including routine follow-up and reviews. Any immediate follow-up required will be immediately actioned, often on the same day, by utilising our network of over 350 clinicians. A date will be set to go through your full results with your dedicated screening clinician. A plan for the next 3 to 6 months, including follow-up calls and onward referrals if needed, are made along with a future assessment programme. We would always recommend a 3, 6 and 12 monthly follow-up post-screen, initially to ensure all immediate health concerns have been actioned, and then to check in to make sure health recommendations are still being followed, and finally, re-review at 12 months to go over your current health and to reassess your risk. We truly believe we offer a service that is unmatched, and we look forward to welcoming you at OneWelbeck for your health screen.